Thank you, Dr. Lackey. Hello, my name is Sarah Hyatt, and I'm a third-year medical student. It is a privilege to be with you all this evening and tell you about our next Medical Hall of Fame inductee, Dr. Joyce Olutade. Dr. Joyce Olutade is a 1981 graduate of the College of Medicine, University of Ibadan, Nigeria, where she also trained as an ophthalmologist. She immigrated to the United States in 1987 with her husband, Dr. Joyce Olutade. She completed an internship at Emory University affiliated hospitals in 1994 and then transferred to Morehouse School of Medicine, where she trained as a family physician. In 1997, she completed a faculty development fellowship at Morehouse. Dr. Joyce Olutade moved to Jackson in 1998 with her husband, who moved here to join a nephrology practice. Dr. Olutade joined the Department of Family Medicine at UMMC as an assistant professor. In 2000, she completed a mini-fellowship, addressing the healthcare needs of the underserved. After completing this fellowship, she was given a grant to enable her to start a free clinic for the homeless. In January 2002, in collaboration with medical students from the University of Mississippi Medical Center and the support of her then chair, Dr. Lessa Phillips, she helped found a nonprofit, the Jackson Free Clinic, the JFC, for the homeless. JFC is student-run and has been operational for 22 years. It has become a multi-service free clinic with students and faculty from the schools of medicine, dentistry, pharmacy, population health, and the School of Health-related professionals, all working together to provide free healthcare services to the medically underserved population in central Mississippi. Free health undergraduate students from 7 universities across Mississippi participate in its ambassador program. Dr. Joyce Olutade, in collaboration with Save Our Future Foundation, Ibadan, Nigeria, helped start a cervical cancer screening program in Ibadan, Nigeria, the first of its kind. Since 2018, Dr. Olutade has served as the Medical Director for Missions for the African Christian Fellowship, South Region, USA. In this capacity, she helps organize and lead teams of African professionals annually to Sierra Leone and other West African countries to provide free healthcare services to rural communities. She also served as the ACF Samuel Town Clinic Medical Director. Dr. Joyce Olutade has 3 adult children, Oyen, Femi, and Ayo, son-in-law Justin, daughter-in-law Carmia, and 4 grandchildren. Please join me in welcoming Dr. Olutade to the stage.
I'm greatly honored to be here among such distinguished alumni and those who've done much more than I have done. I was greatly surprised when I was told I had been given this award. First of all, I'd like to thank God our Father for bringing us here. My husband, Joyce Olutade, and I relocated from Atlanta, Georgia here. There were 2 desires that we had. One, we wanted a smaller city that was family-friendly where we could raise our 3 children. With 2 busy physicians, we wanted somewhere smaller. When I moved to Jackson, Mississippi, my plan was to join one of the urgent care centers. But before we moved, Dr. Lessa Phillips, the then chair of Department of Family Medicine, had gotten hold of my CV somehow. I don't know how she got it. And she kept on calling me, and I would get all these calls from Jackson. I'm like, this lady really wants me. But I just said, okay, I'm going to just go to Jackson and get a place I could work for 3 days a week so I could take care of the children while my husband started his practice. But she persisted, and I finally gave in and joined the department. And that was one of the best decisions I made. Dr. Lessa Phillips was really very supportive of my career. She was a great mentor. And when there was an invitation for faculty to participate in that mini fellowship, she allowed me to go. I had to go like 4 times in the year, and I was excused from my regular duties. I'd always had a desire to provide care to underserved communities, and that was one of the things we wanted to do when we moved here. My husband and I had the desire to make an impact in the life of people who did not have adequate health care. When we came here, we joined a church, and that church provided spiritual and physical services to the homeless population. And as I sat in church watching them, I'm like, what can I do? I'm not a preacher, and there were other ladies cooking food and serving them breakfast. I said, well, I'm a physician. I could provide some health care. During that mini fellowship, I saw a prototype of a free clinic for the homeless at the University of San Diego in California. And when I came back after completing the fellowship, I received a grant, and I told Dr. Phillips I would like to start this clinic. I got her full backing. She was the one who told me, Joyce, go start it as a non-profit. And I've never started a non-profit before. The medical students to whom I presented the idea, they took hold of it and they ran with it. They notified their parents, and I was so shocked to see how the parents came around and supported us. One of the parents, an attorney, Mr. Rowan Taylor, he got the paperwork from the Secretary of State, filled out the forms, and just said, sign here. I signed, I trusted him. And the ball was set rolling. It took about 2 years to get all the things ready, and then we started in January of 2002. Each time I go to the free clinic now, I'm amazed. Each set of students has taken it to a much higher level than I would ever have imagined. And as I stand here, I want to thank God. I thank Dr. Lesa Phillips. I thank Mr. Rowan Taylor, the many students, and I think there's one student here who was there at the very beginning. For the faculty members, my faculty members in the Department of Family Medicine, faculty from other departments who've now joined us. We also had colleagues from the community who came. I remember Brent Drugs, who gave medications to our patients at the warehouse cost without charging them anything extra. I remember the Baptist Hospital that provided lab services for the patients, also at a very basic cost so that we didn't have to spend too much. And lastly, University of Mississippi Medical Center, who came behind us and have supported us all the way since then. I'm also very thankful to my children, who many Saturday mornings were by themselves while I worked at the free clinic. For my husband, who's always supported my ambitions and who let me do whatever I wanted to do as long as it was something good. He knew it to be something good, and it was well worth it. So I'm so really grateful. I'm thankful for this opportunity. I think I just had a seed, and I found Jackson, Mississippi to be a good soil. I planted that seed, and other people came along. They watered it, they pulled out the weeds, and when I look at it now, it's just a big tree, and so many people are benefiting from that tree. So I'm receiving this award on behalf of all those who've labored selflessly to make Jackson Free Clinic what it is today. I've retired from the University of Mississippi Medical Center. I still do some work part-time, but the community of physicians here in this community has been astounding in its support of what we do. So I want to say thank you.
Wow.
Thank you, Dr. Olutade. Good evening. My name is Alexis Lanier, and I'm a fourth-year medical student. It's lovely to be with you all and tell you about our fifth inductee into the Medical Hall of Fame, Dr. Thaddeus.